Balance is a hot topic issue because it's a critical activity for all stages of life, from infancy to old age. Yet at the same time, it's very complex because it requires coordination, communication, and timing, not only from varying environmental factors, but also different systems and parts of the body, mainly musculoskeletal system and nervous system in terms of muscle strength, stability, length, joint position, posture, vision, inner ear function, touch, and proprioception. So when creating an effective balance program, you need to have a sensory-rich environment that will help to trigger and stimulate all of those things. So what we're going to do today is go over 7 components that you can have to help you develop an effective balance program. Prior to beginning, make sure you have a nice, open, uncluttered space so you're not going to trip on anything. I have a wall here to help steady myself, so whether it's a wall, a chair, a balance bar, another person, you want to first and foremost make sure the environment is safe. If you think or know that you have a balance disorder, then prior to doing any of this, please speak with your physician and or your vestibular therapist, because even these exercises could irritate you. Now, the 7 components that I'm going to discuss include body position, points of contact, surface, stance, head position, sight or vision, and movement. So 7 altogether. Out of all of those 7, the most important, in my opinion, is body position. So I'm going to go through the different body positions and show you exercises, or at least a few examples of exercises that you can do in each position. With each of those 7 components, there's an easier and a harder. So obviously, please begin with an easy level and only advance yourself as appropriate. So when you think body position, think of an infant or a child that's developing. So the different body positions include lying on your back side or belly, going up into quadruped or crawling, sitting, kneeling or half kneeling, and then progressing to standing, all right? So, if we're going to start in a lying down position, whether you're on your back, your side, or your belly, you could do simple leg lifts each way. But what I would recommend is trying some rolling, because it integrates multiple directions of movement, head position, and all of the different positions of lying down. So you could do an arm dominant roll where you reach across and come back, so you're going from back to belly, or you can go from belly to back. You could also make it leading with your leg and leading with your leg, and you can do this on both sides, all right? I'm just going to show you sitting here on the ground, and again, you can practice different arm movements. So you can do raises, you can reach across, you can do chops. And all of this is stimulating the core and different things. You can sit head up and look different ways, and it's all going to make your balance work differently. From there, we will progress to quadruped or crawling. And in this position, you could do simple weight shifts, front to back, side to side, adding the little rotation component. You could do arm lifts, leg lifts, alternating arm and leg lifts in multiple directions. Okay? From here, we can progress to kneeling. And in kneeling, I like to use a weight or a medicine ball, and I like to do twists and some chops, okay? If you progress to half kneeling, what you can do is get a nice narrow base And then literally just work on holding this position without losing your balance. Once that gets easy, just try shutting your eyes. Also, while you're here, you could be practicing all those different head positions. All of this will give you a much different type of challenge, okay? Now progressing to standing. In standing, you could do leg lifts, front, side, back, or across. You could also practice some weight shifting in different directions, okay? All of which is stimulating multiple systems. You could balance on one leg, eyes open, eyes closed. You could change your surface and you can get a wobble board or one of those foam Air-X pads, or if you have an exercise mat like this, just roll it up a few times and now you have a more unlevel, uneven surface that you're standing on. And again, easier starting with 2 legs and then progressing for greater challenge onto 1 leg. The variety is endless. So think about the things that you do on a day-to-day basis. Your home environment, your work environment, any special needs or challenges you have, and then you can create a program in all of these different developmental positions to help best suit your needs. If you have any questions or concerns, you can drop a comment below and head over to our related blog on this topic as well for additional information. Thank you for watching.